Hi, I'm Dr. Dan Preece. I am a board-certified foot and ankle surgeon based out of Salt Lake City, Utah. We decided to do a series of lectures for our patients and anyone around the world who might need help with their foot and ankle problems. We're also doing this lecture series to help raise money and awareness for Operation Underground Railroad. This is an amazing group of people that was started by Tim Ballard. They go around the world, they save children from child sex trafficking rings, a very real problem we face. Once these kids are found, this group does an amazing job of placing them in safe, secure environments and taking care of their needs. This is an expensive operation. It takes a lot of time and effort and money. Your donation would be fantastic at Operation Underground Railroad, O.U.R rescue.org. And with that, let's get to our discussion for today. Today we're going to talk about neuromas. Other names for neuromas are pinched nerves, Morton's neuromas, a very common name. Basically, they boil down to a very simple fact that there are nerves that run up between the toes in our feet. There's a nerve that comes along, it splits into a branch and goes into each corresponding toe. This happens on both between the second and third metatarsals and the third and fourth. What's interesting between the third and fourth is there's actually two nerves that come together, join for a moment, and then split again. So there's a little extra nerve material there than in the other space. If that nerve becomes injured or damaged in any way, you get pain throughout the forefoot. People often describe this as radiating burning pain out into the toes. They talk about tight shoes, a specific position when they're doing yoga, a certain amount of time on their feet. A lot of times it's my road bikers, they're doing, they get out there about 20 miles and they start feeling that two toes are going numb and there's burning, tingling numbness. My rock climbers, this happens a lot. Anyone with tight shoes. Also, women often get this. I believe that's because their feet are naturally narrower and there's a lot less space for that nerve to run between the metatarsals. Whatever the cause, what you're going to feel is burning, tingling, numbness in two specific toes, sometimes three if you're getting referred pain or you happen to have two neuromas, one pinched in either intermetatarsal space. It's hard to differentiate this pain from metatarsal phalangeal joints. So these joints here where your toe is attached to the body, those are called the metatarsal phalangeal joints. I've got to rearrange my bones here. When that joint becomes inflamed, it can be because of direct pressure, too much pressure on the forefoot when a person's walking. The same pressure can cause pain and pinching and irritation in those nerves. So sometimes people have both problems. So the real trick is how do you differentiate between neuroma pain and joint pain, which are the two most common problems when you're talking about the lesser toes. Today we're really not talking about the big toe. So how do you tell the difference? If you grab one of your smaller toes and you distract it and you pull it away from the body, something like this, if you grab it and do that and push it upwards, that toe should feel really strong and it shouldn't hurt when you do that. If it feels loose, if it feels like you're pulling that toe up and it has little resistance, and I'm not talking about bending it, I'm talking about translocating the toe up. If you do that and it easily moves and it really hurts, then your problem is either a plantar plate tear where you've torn the tissues underneath the toe that help hold the toe down, or bare minimum you've got what's called capsulitis or inflammation within the joint of that toe. So we're not talking about that. It can be hard to differentiate, but if that's happening, this is probably not a neuroma. On the other hand, if you squeeze between the toes and you feel a lump shifting around, especially if you squeeze between the toes and then squeeze the foot together at the same time and you feel a lump shifting back and forth, if you feel that and it recreates the pain you've been having in those toes, that's a neuroma. So again, you're putting pressure between the toes, just past where the toes connect on the foot. If you squeeze on the skin there and you pull the foot together, if you feel that pain you've been feeling during the day, and it radiates out into the toes and it reproduces what you've been feeling, that's probably a neuroma. So once you've had an x-ray with a podiatrist or a foot and ankle orthopedic surgeon, and you've ruled out stress fractures in the area and arthritis in the little toe joints, there isn't a whole lot more that's going to cause pain in the forefoot. You can rule out neuropathy and nerve pain and other things that happen with diabetes, etc. If you've narrowed it down and the pain is reproducible and it's between the toes and it seems to recreate what you've been feeling, then the question is great, what do we do about it? We've got a pinched nerve down here. If it's brand new and it hasn't been happening very long, that nerve may still be very healthy. And if we can relieve the pressure on the nerve, we might be fine. If the nerve's been pinched and irritated long enough, you start to develop what's called the neuroma, the Morton's neuroma, and that means the nerve is enlarged. It's kind of tumor-like, and it means if you look under a microscope, it's going to have a lot of fatty infiltrates, a lot of scar tissue type material build up around it, and it's a very unhealthy enlarged nerve that no longer fits between the bones. So if we back up, if the nerve's still healthy and it's just pinched, a couple of things can really help. One of the first things you can do is wear a good orthotic. Now this has to be a rigid orthotic. It needs to be something really strong and tough, something that you can't easily bend. We're not talking a cheap Dr. Scholl's orthotic off the counter. You can get some that might do the trick. Power Steps are a good one, or Super Feet. They do offer enough strength in the arch that it's going to shift your weight up into the arch and off of the ball of your foot, but it has to be pretty strong. If you can combine that with padding, metatarsal pads that go underneath the metatarsal heads, if the pad is perfectly situated, it'll sit right there, not on the neuroma, but a little bit behind it. It'll help spread the foot out. If it spreads the foot out enough, the nerve might have enough room to maneuver and it might not hurt as much. So an orthotic can do the trick on its own. An orthotic with a metatarsal pad can do the trick. Shoes are absolutely critical. If you wear flip-flops, if you go barefoot, if you wear shoes that are super flexible, when you walk, you're going to dump all your weight right on that nerve or the adjacent bones or both, and it's really going to hurt. And it won't give you a chance to heal. If the shoe is really stiff like this guy and it barely bends, you're going to get this number instead of that number. And again, this shoe is really stiff, so it's hard to demonstrate, but if you get a really flimsy shoe, you can literally fold it in half. And the flimsy shoes, they're the root of all evil for a lot of forefoot problems. So shoes, orthotics, metatarsal pads on the orthotics, that's a decent way to start. Sometimes that does the trick. I have had plenty of people have good success with elevation, rest, compression. That's got to be avoided. You don't want to be compressing this thing, so we're talking wide open shoes, very loose open shoes. One of my favorite shoes is Ultra, A-L-T-R-A. They have the widest toe box of a shoe I've ever seen. It's quite a bit wider than this guy, and it gives that room, gives the foot plenty of room to maneuver. Where was I going with that? Oh yeah. One thing I've seen people have success with their physical therapy is to do lots of stretching. We're talking about manipulating these toes, getting things loosened up, moving the toes in every which direction, kind of opposite of each other, and then deep tissue massage between the bones, the metatarsals where the toes attach. I think it's possible to manipulate and stretch out the tissues enough that that nerve can move back into position or at least take off some pressure. I've had a number of patients go to physical therapy, and that's basically all that was done between icing, 20 minutes on, 20 minutes off, heat packs, ultrasound, and different things they do. And sometimes that nerve calms down, sometimes it finds a better physical location between the bones, and people do great. So, good place to start. You're looking for steady improvement every week. If that doesn't improve things and your pain's still mounting, or at least you've plateaued and you're still in a fair amount of pain, if the pain is making you avoid good healthy activities, working well, and if you're being aggravated all day long and these things aren't working, then it's time for something more invasive. For me in my practice, the most common thing we'll do is a steroid injection. I think I happen to have some here. We're talking a mixture of Kenalog and dexamethasone and some local anesthetics. We'll inject right between the metatarsals, right at the beginning of where that nerve starts to become pinched. The idea here with the steroid shot is that we're trying to calm the nerve down. We're trying to knock the inflammation out that's causing the pain. This might solve the problem if the nerve is only irritated and you change everything else as far as shoes and orthotics to prevent that pinching and irritating moment from happening again. If you don't address the physical cause of the pain, it's going to come back. You know, if you're a biker and your shoes are too tight, guarantee you the steroid shot's only a band-aid. It's not going to work forever. But if you address everything else, and the nerve is in a decent shape, it's in good health, a steroid shot might calm it down and get it back to the pre-neuroma type state, and you might be fine. So steroid shots are great, good thing to try. One thing you have to be very careful about, steroid shots can weaken tissues. They cause atrophy of tissues if you use too strong of a dose or you have too many shots in the same place. Probably the most common question I get about steroid shots is, I thought I could only have so many shots in a lifetime. Truth is you can have hundreds of shots. What you can't do is put the same injection in the same spot again and again and again, or you'll see the tissues waste away. What I'm getting at here is that if you inject in the same spot between toes too many times, it's very possible that the tissues that hold the toe down, that is, they're going to weaken, they're going to soften, and you're going to get hammer toes. Or the fat pad underneath the metatarsal heads and the ball of the foot is going to waste away, and now you're walking skin and bone right on the ground. So you have to be judicious with steroid shots. I'll do one or two, and if that doesn't solve the problem, or if it hasn't been years since the last one, I'll do another one. But after one or two, if that doesn't solve the problem, we're moving on to the next thing. So steroid shots are a good first place to start when you're talking more invasive therapy. In my practice, the next thing we're going to try, if the patient has no interest in surgery and they're thinking, I want to exhaust all possible conservative treatment, is we're going to start doing a series of alcohol shots. This is dehydrated alcohol. The idea here is that when you put the alcohol around the nerve, it's going to start to denature the proteins that allow the nerve to send you pain signals. So even though the nerve is still there, we're removing the nerve's function and its ability to send your brain pain signals. So the problem with the alcohol shot series is that you have to do a fairly long series of it for it to work. Most of the studies I've seen in my own experience is you need to do at least 6 to 8 shots to get the nerve to an unhealthy position where it can't send you pain. So you need to do the shot consistently. The shots need to be done every at least 10 days, maybe 2 weeks at the most. So somewhere between 1 to 2 weeks, you do a shot again and again and again. So it's a marathon. It's not an easy series to do. They're quick shots. You can use a small needle, so it's not the end of the world. And I've had plenty of patients receive almost complete pain relief that lasts a long, long time. And they've been able to avoid a trip to the operating room. So alcohol shots have some good data, very few side effects. If it doesn't work, heaven forbid, sometimes things don't work, we may end up going to the operating room anyway. But that's okay, because the alcohol won't have burned any bridges. It doesn't make it so that you can't heal. It doesn't destroy anything. It's simply denaturing proteins inside the nerve, and you can do surgery afterwards, no big deal. One thought about steroid shots is if you're going through this protocol and you've changed the shoes, you've changed the orthotics, and you've tried metatarsal pads, you've tried stretching and icing and the whole thing, you've done a steroid shot and it didn't work, and you're thinking, now I need surgery, the doctor had nothing more to offer me, you really don't want to have surgery within 6 to 8 weeks of having that steroid shot. Steroids decrease your body's ability to heal, and if you do surgery right on top, if you make an incision right on top of the area where you've had a steroid shot, you may be looking at a dehiscence where the skin opens up after surgery, and then you've got a long road ahead of you as far as healing. So just a thought. Just something to be concerned about. So let's say you've tried steroid shots, you've tried the alcohol shots, and you're still not happy. Now we're looking at either changing the position of the nerve or removing the nerve in its entirety. The truth with removing pressure on the nerve is that the data on that, the studies on that have not been great. So we're talking about a percutaneous procedure where we put a little probe between the metatarsals. There's a ligament that crosses between the metatarsals that the nerve dives underneath. Theoretically, if you cut that ligament, the nerve can relax. It's not under so much pressure. This is very much like carpal tunnel surgery. In theory, the nerve would be happy, you move on in life, right? Well, the studies haven't borne that out to work extremely well. Yes, there are doctors doing it out there, and they have had success, but the data keeps coming back showing that success rate's 50%, 70% at best. And it's not high enough for me to say, oh, we need to do that, we should do that, or even be a sequential part of the treatment protocol. So it's an option. If people are just dead set on not having a nerve removed, that's something you can consider. The end-all be-all surgery for neuromas is to make an incision, typically on the top of the foot, right between the metatarsals, dissect down, go through the ligament that connects those metatarsals, find the nerve, trace it out to the toes, trace it back as far as we can, and take the whole thing out. I have found that the success rate with that is way higher than anything else, but it comes with risks. You cannot do a surgery like that without taking a risk of having nerve damage. Sometimes you can have phantom pain where the brain still thinks that the nerve is there, so you get some of the pain from before. You also worry about infection, bleeding concerns, anything that would come up with a normal elective surgery, you have to be concerned about. So before I'll consider surgery for any of my patients, for any reason for that matter, I need to hear from them, Doc, we've tried everything within reason. Nothing else out there that is backed by science has any hope of fixing the problem. And my life is really being inhibited by this. I'm unable to do healthy, good activities in my life. And I've got nothing to lose because I'm losing a lot already in my life. That's the person who should go under surgery, go under the knife. I find people rushing to surgery thinking it's a quick fix and it's going to solve all their problems, and it may be, and I wouldn't offer surgery if I didn't think it was a good solution, but be warned that surgery comes with significant risks, and you should really think about it long before you go undergo the knife, because there's no going back. Scar tissue will form, things are going to happen. Once the surgeon sews you up, he has no more control over what happens of how your body heals or doesn't heal. And so just a word of caution with surgery in general. Neuroma surgery usually goes well. It's a very simple surgery. Like I mentioned, we make an incision, take the nerve out, close it up. It's pretty quick. On average, mine take 10-15 minutes at most. What you need to watch out for after surgery is swelling, getting out of hand, and opening up the incision. You're worried about bleeding being excessive and opening up the incision as well. And of course, infection. We've talked about that before, but if you go through the typical surgical recovery where you hurt for a few days and pain gets better and better, that's pretty normal. If after that, all of a sudden you start having a spike in pain, especially if it's accompanied by fevers, chills, nausea, vomiting, anything like that, call your doctor immediately, get to an ER or instant care, get help, because you probably have an infection brewing. A little bit of bleeding is normal. If you get a patch of blood, let's say the size of a quarter or a silver dollar, and it dries up, no big deal. But if it keeps coming and it really soaks the dressings, you need to change the dressings quickly. You do not want to let that stay wet, or the skin's going to have a hard time healing. Stitches usually come out at 2 weeks. The foot heals a lot more slowly than anywhere else in the body, and that's because blood flow is poorer and oxygen content of blood is poorer. By the time it gets down to your toes, there's not a lot. I shouldn't say not a lot, but there's not as much oxygen available, and things just heal more slowly. So stitches come out at 2 weeks. Once those are out, technically you can do whatever you want. However, the truth is that ligament between the metatarsals needs to heal. The inflammation that's going to be created because of the dissection in there is going to last for 4 to 6 weeks or even longer. So I tell people, be patient. It's going to take a month or two before you start feeling like you get back to normal activities. But after 2 months, usually we can progress into normal shoes, away from the post-operative sandal if they haven't already. And we can get back to orthotics and good shoes and move on in life. That is neuromas in a nutshell. Now, there are a couple of other things that you can do that have kind of come and gone. One of them is called Neurotherm. That's where we put a little percutaneous probe through the skin on the top of the foot under ultrasound guidance, put the probe next to the nerve, and there's a couple of different companies out there, but one of them burns the nerve, the other one freezes the nerve. Either way, the nerve's still in there, it can recover, and much like the release of the ligament between the metatarsals, success rates haven't been that great, and they've kind of gone the way of somewhat failed procedures. Again, there are people out there who've had it, who had great success, fantastic. But when I offer my patients a surgery, I want to say to them straight face, this has a 90%, 95% chance of being successful. So for you to take the risk of surgery, it's worth it. I can't say that for Neurotherm or the intermetatarsal ligament release. That's just where we're at with the data these days. that sums it up. Please keep in mind that we are doing these lectures for Operation Underground Railroad. If you like the lecture, that we have a whole bunch of others out there, they could use your donations. Go to OURrescue.org. These folks are going to use your money in a very wise manner. They're going to help fight child sex trafficking around the world. They find these kids, they free them, they put them in great aftercare situations where they're going to be taken care of. Your money will not be better spent anywhere else with any better charity. So with that, have a great day.